appears to have been beneficial on our immunity. Unfortunately, post-operative fasting for 2.5 days after surgery is unlikely to be enthusiastically embraced by my patients. So this detrimental effect of glucose on phagocytosis has been reproduced in other papers. It's almost as though this basic physiology of our immune function has been ignored for decades. Elevated blood glucose is well documented to create poorer function across most blood cells, which affect immunity and clotting states. Small glucose loads can increase erythrocyte aggregation within minutes, which is part of a prothrombotic state. Osteoarthritis is now seen to be an inflammatory condition rather than purely a wear scenario. Advanced glycation end products appear to be the damaging molecule of articular cartilage. That combination of ages and oxygen-free radical formation contribute to articular cartilage damage. This is exacerbated by the inflammatory effect of insulin, as discussed earlier. At the cartilage level, we see the byproducts of carbohydrate metabolism causing harm. We do not see the byproducts of protein and fat metabolism. I was discussing this with an orthopaedic colleague who has an interest in ancient skeletons. Pre-agricultural revolution skeletons do not have the osteoarthritis picture that we currently see, is that because of their reduced carbohydrate and inflammatory lifestyle. Likewise, those same byproducts of carbohydrate metabolism are present within degenerate tendons. What was once thought to be a wear and tear issue of tendons turns out to be an inflammatory problem secondary to the same ages and oxygen-free radical production that is occurring in joint cartilage. I looked through the literature to see if the same process was occurring in the discs of the spine, and that has not been documented. The harmful effects of carbohydrate appear to be localized to the cartilage and the tendons rather than the spine. Across all specialties, there are higher rates of post-operative infection associated with perioperative hyperglycemia. So to truly consider if carbohydrate in excess is toxic, one needs to look at the literature to see if the removal of the toxic substance results in improved outcome. And removal of glucose loads is documented to improve glycocalyx thickness and function within hours to days. The removal of fructose in an isocaloric fashion results in improvement in non-alcoholic fatty liver disease within days.